Hall. Welcome everybody. This is another Moy Family Association DC Zoom event, and today I'm going to be discussing the different theories and application ideas for acupuncture, acupressure, and some of the tools that you might run into if you go to an acupuncturist. Now, I have to tell you, I'm not a licensed acupuncturist or doctor, right? So if you want detailed diagnostic questions, you have to go to your local acupuncturist where you live for that. But I have studied acupuncture since 1975. I studied with a few doctors. I've had many seminars. I love the science of the human body. So I have a pretty good grasp on the information. But I'm going to give you, again, a little idea of what you might run into when you go to make an appointment for an acupuncture session. Okay, so first of all, I'll grab my glasses here. I wanted to mention the first person I studied with was Dr. Rose Wong from the Chinese American Culture Institute in Chesterland, Ohio. And that was in 1975. She had actual classroom sessions for acupuncture and acupressure. And of course, in the 1970s, you had to be a general practitioner, MD, in order to practice acupuncture in the state of Ohio. Well, I didn't have the extra money or time to spend 6 years in medical school, so I just never followed through. But I did the studies and I did the seminars and things like that. 1975, yeah, with Dr. Rose Wong, and she had really interesting classes. Our first day there, we all got on our desk, and every desk had a little bag this big, full of dried rice, and I had no clue, what the bag was for, of course. And so she introduced herself, came in, and you had to take the bag and take your knuckle point ridges and roll your knuckles against this canvas bag with the dry rice inside. And her explanation was, you keep doing that until the rice is pulverized and powdered. And I'm thinking, okay, what's this have to do with acupuncture? But the main idea is so that your relaxation rubbing process for massage could be just as effective if you use your knuckle point as if you were inserting the needle, right? So we would, rub these things, your knuckles would get sore and get red and they'd hurt. But weeks of this, your knuckle pressure was really hard, and you could really penetrate the muscle tissue and fascia, get into the point area that you needed to. So I studied with her. This was my study book. I've kept all of my books and tools that we used back then. And this book has everything basically that you would need to know for a study process, all the charts in here, color foldouts, how to insert the needles, things like that. And so the bad news about all this nowadays is you can get online, and I don't suggest doing this. You can buy your own acupuncture tools. But my suggestion is go to a licensed doctor that performs acupuncture legally, right? So been studying a long time. The connection to study and then actually applying it back in the 70s, all we had to deal with was almost like what nurses did back then if they wanted to do a hypodermic syringe needle. You practice on an orange. So we'd insert the needles in the oranges, right? Nowadays, they have these nice little rubber pads that kind of feel like a human epidermal, and you can insert the needles and practice that way. Back in the 70s, we had none of that. The second doctor that I did seminars with was Dr. Susan Deng, and her married name now is Liu Shui-Shan, and she's so proficient at it, but that she actually works at Cleveland Clinic in Ohio. They have a department where they can do herbology and acupuncture and things like that at Cleveland Clinic now. And if you want to contact, if you live in the Ohio, Pennsylvania, Indiana area, if you want to contact her, she's in the Beechwood area, Woodmere, Ohio. And I have her phone number and address if you want that later. A friend of mine on Facebook, Dr. Matt Mason, is with the Mason Wellness Clinic in Warren, Ohio. And I've never studied with him, but I know that he is very proficient. He's also a chiropractor. And his wife, Julianne Donato Mason, is also a chiropractor. So they're a great team, both licensed acupuncture. And his motto for the Mason Wellness Clinic is helping sick people get well. And here's the important part, and educating each person to stay well. So it's one thing, to go to a doctor. But as we all know, if you go to a standard MD, they prescribe synthetic drugs. They don't really look into the cause unless it's a severe affliction, too much. They pass it off on a pill. Now, and that's just a generalization. No offense to any doctors out there. I know you spend a lot of time studying also for your craft. But at least with Matt, he's going to educate you. He can also prescribe herbs, right? So it's not just needles or cupping or something like that. He can help you get on the path of getting that yin and yang balance in your system, that electromagnetic chi connection, right? So that we can stay healthy and we can educate ourselves on how to keep that going. Very important. All right, now a little bit of history. So I also, and one more person, I also studied or did an in-house seminar with Dr. Stephen Fung. He's from the New Jersey area, I think. I haven't been in contact with him for a while, but I met him at the world competitions, Chinese world competitions in Tulsa, Maryland. And he was the first person that I experienced watching, and he did electric acupuncture. His patient was one of the competitors, and she was laying on the table, and she had a severe strain from the femoral bicep, the hamstring. And so he put a triangular shape of the needles at the top, under the glutes, to the base of the knee, and they were connected to wires on this little scent machine. Basically, it had the 9-volt battery in it. And he turned the dial up to about 1.5 or 2 cent, and the whole muscle, like a TENS machine, the whole muscle was flexing and releasing as a massage process. Pretty interesting. Okay, so how old is acupuncture? I've gone through all my old notes from class. I've got online, of course, nowadays, and try to find a clear answer. Little difficult, but as far as I could find out, around 90 BC was the first evidence in written document where they used the Chinese term 射击, which means insert needle. And this was from Huangdi, the Yellow Emperor's classic, also listed as 100 BC. Or they found out that literary experts say that it was more likely the 5th or 8th century. Okay, so that just gives you an overview. And you can find all this online. You look up the history of acupuncture. I'm just trying to give you a quick generalization here. In 1279, up to that point now, the prototype of a systemized acupuncture system started to take place. So in other words, they started to find acupuncture points that they could all agree on, that they knew worked, right? Instead of just literally poking and hunting. We were told in class that some of the first acupuncture studies, of course, were done on prisoners. And they found out that by inserting bamboo slivers as a torture, that some of the afflictions of the prisoners were actually improving. So they're getting healthier. So they started to study that more. By the Qing dynasty, the 1600s, finally steel needles were starting to be more prominent. Up to that point, from about, and this one says about 6000 BC, the needle trial and error period of history, they started to use stone shards, so little slivers of stone. Bet that felt good. Bone slivers, bamboo slivers, like I just mentioned, wood thorn shapes, and then bien was the stone shreds. Then later on, they started to use copper, bronze, gold, silver, iron, and tin. So they went through this long procedure of trying to find out what the perfect needle is for insertion and how it affects the electromagnetic connection that they're trying to improve. Now, when a needle is inserted, it can either block a certain path of electricity or activate, improve a certain part of electricity in your system. That's what helps with that yin-yang balance point, right? So the needle connection of that was very important. International standard across the world in 1989 lists 409 standardized acupuncture points. Now, when I was studying, Dr. Rose Wong used 998 acupuncture points that she had listed. So every doctor you run into will probably have a little different opinion on that, or the most popular ones that they use to help their patients. So it's not unusual, again, to get some conflicting views on the point system. But when they have a point, it's the same point. You can go to doctor. You know, for example, the He-Gu point at the V of the index thumb connection, harmony bone point, is one that they usually use for headaches, migraines, things that are involved with the upper sinus and ocular area. So that would be, you know, one of the points. So going from the international standard to, again, some of the varying opinions from different doctors, you can run into upwards to almost 1,000 points. Now, I had one doctor tell me that, well, you know, your epidermal structure, of course, is an organ in and of itself. So everywhere the nerve system runs, you could find possibly another phantom or ghost point that would help the main point of that meridian or that area. An acupuncture meridian is a line structure, almost like a railroad line that runs through the body, and it connects to all the internal organs. And of course, then the branching out nervous system from that can help different afflictions. So in other words, if you would happen to have a problem with your ankle, maybe the procedure would be happening somewhere around your hand, right? So the lines run all through the body that could help in different connective areas. For example, our liver meridian goes from about the big toe through the leg, through the groin, and then kind of zigzags up the side of the oblique area. So it's pretty interesting. If you look up acupuncture charts online, you'll see a myriad of railroad lines basically that go through the body for these connections. You know, and then the one that we work on all the time that I'm proficient at is connecting acupuncture point lineup for Tai Chi and Qigong, right? Most of the time, your Tai Chi instructor will tell you, of course, here's a posture, right? This is part horse's mane. And sometimes it's like standardized Yang family. The hand connections are lined up on purpose to the meridians or the acupuncture point, right? Other family styles of Tai Chi don't either teach that or know that. So you can have a part horse's mane that looks like this, and it's not really lined up to anything. Or again, you can have the exact lineup. So the exact lineup for this is the Lao Gong point, the base of the second callus pad, which is our heart or pericardium point, and it lines up as you aim it back to the heart. Okay? The He-Gu point, again, that harmony bone point, is lined up with the Dai meridian around the intestinal ridge. So even just holding this posture, whether you're performing Tai Chi in movement or Qigong as a holding process, is already giving you that electromagnetic massage connection. All right. Yeah, the next one, even standing, sitting, doesn't matter. Just Tai Chi beginning for almost all forms. The arms open, roll back through the shoulder, elbow, wrist, settle the rib cage down towards the hip bone. Inhale, nose. Exhale, mouth. So as you're doing this as the start of most Tai Chi family forms, most people don't tell you why or how it's working. Sometimes they'll explain the martial art self-defense function, sometimes they won't. But as your forearm ridge on the inside is lined up, that's our large intestine ridge. So even just doing Tai Chi beginning, whether you do it in movement with the body connection for, again, that open and close massage process to the internal organs, or whether you just get to the holding position about collarbone point and leave it there as you continue to breathe, you already have that connective lineup for the large intestine. So, it's a very intricate neurological science. I've studied, like I said, since 1975, and I keep finding out new things. Of course, again, all the new properties and tools that they have out nowadays is pretty amazing. I just messaged Matt Mason from his clinic a couple hours ago, and I asked him, I said, well, do you use surgical gloves? You wear a mask, with your patients? And he says that he doesn't. A lot of guys don't, a lot of women don't, but some do, so, if you go to an appointment, they may be, throwing on a standard surgical glove. They might be wearing a mask. It just depends on the doctor or the person. The connection with the needle nowadays is so sterile and so health safe because they come in little, you can get them in little guiding tubes. In the old days when I learned, it was all hand to hand. You just picked up the needle and you inserted it, drilling or twisting. And the insertion levels are different, of course, for every affliction. And Dr. Rose had a little sterilization pod like you would use in a doctor's office in the old days, right? Nowadays, you get a brand new needle all the time for everything, right? We didn't have that back then in the 70s. My rubber model here, shows the basic connection for needle insertion, and you can get either straight in to the point or on an angle. And this is the main idea, the closer the epidermal is to the bone structure, the more of an angle or slight insertion it might be. If you have a larger muscular area, you can go a little deeper into the muscle tissue past the epidermals into the fascia. So again, the depth of it can be different. Every affliction, of course, carries its own amount of needling, sometimes 1 or 2 needles. I'm sure you've seen the pictures online of people having 20 needles or so inserted. It just depends on the affliction. Probably the most popular thing I saw in the 70s and 80s as far as stories about acupuncture, because my joke is, ever since President Nixon discovered China in 1972, 73, the AMA has been studying acupuncture and herbology and trying to see if it really works. But the most popular thing I saw back then was a woman was giving birth. Instead of doing a synthetic drug block for the hip, like the spinal, they were using acupuncture to block the spinal when she was giving birth. Pretty amazing. Look it up. Don't take my word for it. So it's really interesting science. You can find out so many different details nowadays. Let's see. Some of the tools, right, that are involved, of course, and this is I've kept all of my tools that were given to me by my instructor when Dr. Rose Wong and her husband, Professor Peter Wong, this was from Chesterland, Ohio. They had the Chinese American Culture Institute. When they decided to retire, they moved out to California with their son. He called me up one day and said, "Oh, Maka," he says, "why don't you come out to the house? And we've got a couple things for you. We're retiring. We're going to, travel a little bit." So I thought, oh, okay. Well, typically, if in Chinese culture you give someone a present, it's usually maybe just a red envelope or a little, trinket of memorabilia or something like that. So I show up, and Professor Wong's out in the garage sleeping, and Dr. Rose Wong's inside getting stuff packed up. He goes, "Oh," I says, "Good." He says, And thank goodness at that time I had a van. He said, see those 3 boxes in the corner? I said, yeah. He says, those are for you. And these were boxes, right? So I said, well, he says, you're the only student that we've had through the years that is studying and teaching, not teaching acupuncture, but teaching Kung Fu and Tai Chi. And he wanted me to have all of these tools that they used. So I had everything from Chinese musical instruments, erhu, the Chinese violin. He had some martial art equipment. He also taught Wu family style Tai Chi. And then a lot of his acupuncture gear and the charts that Dr. Rose Wong had. So this just to let you know, and also, like anything else, and I'm sure these are out of date, but your acupuncture needles can go out of date. They have an expiration date on them. So, I don't use these, of course, I just put them in my little rubber guy. But this is what they look like. And this is the tube that they come in, right? So you can, in my opinion, a lot easier than the old days. You can set the tube up on where the point is. And then after you remove the little safety thing, you can tap and twist in place. The tube gives you a nice guide connection to that instead of just holding it in your fingers and, target practice, aiming. Yeah, and again, just my opinion. So they work a lot easier nowadays. The next needle idea, and there's different types of needles too. I want to show you this real quick. This was the ancient needles that they started off with. Now, and it was known as the 9 needles, or the 9 classic needles. And you can see the different shapes. Some were very long. Some, and I can't imagine the feeling, were sword or spade arrow point that they used to use. And these 2 in particular, the larger, broader ones, the famous story was when Guan Yu had a poison arrow shot in his arm. His doctor was Hua Tuo. Hua Tuo was a very famous physician from China. And this is his painting, of course. But you can see in his hand, he's holding one of those broad spade or sword type of acupuncture implements. Anyway, and this is the famous painting that you normally see of that session. He was playing chess or mahjong, not really sure, but Dr. Hua Tuo was using an incision cut and scraping the bone to get the poison off. And Guan Yu, was supposedly just, nonchalantly playing chess, not worried about it. Pretty amazing. So different types of needles. Nowadays, most of them look the same, long, thin. And you can get fairly long ones, of course, and very short ones, depending on the affliction that you have to use. This is called a plum flower hammer. And this has 7 needles. And I've seen larger hammers with more needles on it. But this is a tapping effect. Now, it's not meant to really draw blood, but just to agitate the area. You'll see kind of a red rashy formation. They use it for different afflictions. Tennis elbow, they tap this way. People that have hair loss, you can use it and tap the scalp. Again, pretty interesting. The other thing that draws redness to the area, and they call it a gua sha, that means scraping sand. And you take a jade implement usually, and again, massage or rub with this, and it creates, of course, standard epidermal scraping will start to get red anyway, but it increases the blood flow to the area, helps with any kind of stagnating blood. The old traditional cupping that's used, where they would dip the cotton ball in alcohol, light it on fire, and then insert it in a glass bulb quickly, and then put it on the skin, and it draws a section of the skin up into the bulb. Another massage type process. It releases toxins from the epidermal. You can find pictures online of people, especially on their back, having upwards of 20, 30 cups on their back. You can do cupping almost anywhere. They come in different sizes, right? The newer, this was all we had to work with in the 70s. The newer one is dry cupping. And that's where they put just a little plastic cup into a pump handle, put it on the epidermal, and pump it into the skin that way. And you can see it sticks on there and it pulls the skin up into the cup, right? When you want to release it, just release the handle, right? But again, it's good for relieving toxins. If someone has a sore shoulder, sore leg, anything like that, you can ask your doctor and they'll apply it correctly. Also, just to let you know too, as you're in the clinic with your doctor, they'll have their own sterilization process, of course. In the old days, all we had was either the sterilization pod that you would put it in, or a little later on, we would have Clorox or bleach pads that you could wipe it out with. Right? So just like any other kind of medical procedure, they'll use alcohol, their own sterilization, or a brand new cup or a brand new needle, of course, every single time. The other thing that's very popular, and of course this is a new item, is the moxa or moxibustion. It looks like a little stick of incense. See if you can get that closer. You see that? In the old days, you had a little, almost like Play-Doh pod of moxa herb, and you would just roll up in a little ball. After the needle was inserted, they would put the moxa on top of the needle. Like that, the heat would transfer from the moxa down into the needle point. Or they'd take a pinch of or a slice of ginger root, put the moxa on top of that, and light it. The heat would transfer. The ginger root itself would keep you from getting any kind of burn on the epidermal. These, very convenient, have a stickum metal piece on the bottom. You put it in place on the acupuncture point area, light it like you would incense, and the heat transfers right down into the point. They have varying degrees of heat transfer, the different colorations. The red is the hottest one if you need to get a lot of heat to the area. They have yellow and green also for lesser amounts. If it gets too hot, gets uncomfortable, the acupuncturist can extinguish it, take it right off the skin, and you're ready to go. In my opinion, having a study of the human body is essential for this, of course, and that should be happening in your classes. I had about 4 of these when I was growing up. I've always loved internal medicine, and memorizing, of course, the lungs, the heart, stomach, liver, intestinal ridge, and knowing how those connections work in and of themselves, let alone what the acupuncture connection would be to that, is vital. Just like any doctor would be. The skeletal structure also, you can take this apart and go through the whole skeleton connection. On the lesser end of connecting to the acupuncture system, right? And you've seen these in probably every Chinese gift shop in the world, the little exercise balls. Now, rolling these in the hand, they have a little chime. You can hear this. Little chime inside. So not only the exercise procedure of getting the hand, finger, thumb connection, right? But also that chime vibration vibrates into and around the whole hand, finger, thumb, meridian, and or acupuncture point as you're doing this. So this is very good for the whole hand connection. Someone suffering from any kind of hand, wrist affliction might be able to work these, right, a little bit. They come in different sizes. The one we use at class all the time is just a basic exercise ball. You can get it almost any dollar store somewhere, but make sure you get the one with the little nubs on it. So you can take the ball and not only, martial art wise, roll it for any kind of grappling connection. If you're studying Tai Chi, you'll know about Tuisho, push hands, right? But also for the acupressure idea, you find a point you need to work on, you can roll those nubs into the point area, right? You can do it anywhere. Works really well. And only about $1 or $2. The other one I talked to Garan about this earlier. You can get all types of jade, wood implements to do that same thing. This one has the little nubbies right on the wheel process. Same idea. Right? Rub across that. So trying to get all these connections in there so that you have a pretty good understanding. You make an acupuncture appointment. You don't know what to expect. This is what you can expect, right? You can go anywhere from basic massage value, inserting needles, the cupping, variations on cupping, moxibustion with the little heated herb, down to the basic idea of just rolling the exercise balls. I think, and the last thing then, when they're trying to diagnose things, and again, I'm not a licensed acupuncturist, I can't diagnose for you, but just to let you know what they might be going through, there's 12 pulse points in the wrist area. So, everyone knows about the heart pulse point. That's what the nurses do, when you come in. But there's 3 superficial on top and then 3 deep internal. And each pulse point regulates to a different internal organ. And it's just, different organs on either side, different depths for each organ. So when you come in and they start taking a pulse here, and then possibly here, and then do it again and push a little harder to get the deeper pulse reading, right? They could be looking for the pulse generation in a different organ. That also helps them to diagnose the affliction. Just like I got these. This wasn't a real clear copy, but you can get the idea. This is how they diagnose from your tongue. And each area of the tongue represents a different internal organ. And when they're looking for tongue diagnosis, of course, they're looking for swelling, puffiness, saliva content, coloration. Do you have a coating on your tongue, things like that, dark spots, right? So they can diagnose that way. Facial implications for the internal organs. Each area of the face is another connection through a meridian line to the different internal organs: kidney, liver, heart, bladder. The eye itself is the same idea. So going around the white of the eye into the iris and cornea, they can look for coloration spots in there and tell you a different, internal organ connection for that around your eye. Going into the hand and foot for what's called reflexology is another massage process that they might do to you. And each portion of your hand and foot lines up with an internal organ or area of the body, right? So almost like the lineup of the internal organs, like on the model, you can go through and start at the top: brain, sinus connection, ears, heart, lungs, stomach, small intestine. So just like our body connection is lined up, the foot and the hand will line up basically the same way. So that's why I mentioned earlier, when you connect the Laogong or heart point in the hand in front of the pericardium, you automatically get that electromagnetic connection for massage process. And again, no offense, but other Tai Chi styles that don't do that or don't know that are missing some of the good health benefit. It's like, you know, if this is your electrical socket and here's your lamp plug, and you try to plug it in there and there instead of plugging it into the socket, the light's not going to come on, right? So can you still get exercise benefit from doing just the Tai Chi movements? Yes, of course. But it's also enhanced if you know how to line up the acupuncture points and the meridians while you're doing it. Okay. And that's about how we doing in time, John?
8:06.
Okay. So, and that's all I have for that. Now, if we want to go into some questions and answers.
I have a question. What about ear seeds?
What about, oh, seeds?
Seeds.
Yes, they've been using that quite often for usually weight loss. Was the first one I heard about. And Dr. Susan Deng, Lu Shui, would put a little mustard seed at a point of your ear, tape it on there, and about 3 or 4 times a day, you're supposed to pulse and rub and push on that. That activates the hunger pangs in your system, and so helps you to lose weight. They've done that also, the seed process with trying to quit smoking, things like that. Yeah, very popular. Yeah, if you look at the, I don't have a layout of the ear, but you can look it up online. Type in ear chart for acupuncture, and you'll see, because they explain. I'll get a little closer, John. The lineup of the ear is like the fetus, a baby in the womb upside down. So going from the head to the spine and curled around the tailbone, and then inside, of course, the ear, you have a lot of the internal organ connections. So it's possible to insert a needle there, you know, from your doctor, but the main thing is a massage process and or using the seed system. Mm-hmm.
I have a question. Will the treatment matter worse? And how do you know make matter worse? Like, because acupuncture, can they put in the wrong hole or do the wrong thing?
Oh, okay, yeah. Well, I mean, just like any doctor, any medical procedure, but I've never heard of someone going in for acupuncture and then coming out and saying, "Oh, the affliction is worse now." Almost always helps. There could always be, you know, a mistake or an accident, but the study of the points and the meridian is so, you know, clear cut nowadays. It's pretty hard to go wrong. If you look up needle insertion for acupuncture, like online, I'm sure you'll find cases where maybe the doctor inserted the needle too far, hit a blood vein, or didn't insert the needle far enough, and then it didn't hurt the affliction, but it didn't improve it at all. You know, there's varying degrees of, you know, how good your doctor is, of course. What else?
So, Mark, I have a question. I'm a big fan of reflexology, but, you know, can you do that on yourself? I mean, I remember when I was younger and I couldn't sleep because I was really agitated, you know, too many things. And I had a Navy chief told me, if you can't sleep, just put your feet into hot water. Can you talk a little bit more about reflexology?
Sure. Yeah, and of course, you know, everything that our grandparents told us about when we were younger, we thought, oh, old wives' tale. But as AMA has been studying this, again, seriously since the 1970s, they found that these old wives' tales work. So everything that Popo told you is good. So using everything from their herbology, right, mustard packs, the different remedies that we have herbology for, soaking your feet in Epsom salts, witch hazel, anything that's available to you like that, is real and it does affect. Now, reflexology itself, going back to the hand and foot, and again, you can look up these patterns online. If you want to try the massage process yourself, a rubbing relaxation, that's fine. It's better, of course, if you get to a qualified licensed doctor. But you can do all types of little things. Even this one, I mean, you have a headache. What's the first thing most of us do is this, rubbing the temples. That's a basic logical form of reflexology. The yin tongue point between the eyebrows, they say that if you either tap that or massage that area, that helps relieve a lot of tension and gets rid of anxiety. So yes, you can definitely try that.
That got me wonder, do you have any physical problem? And if you do, how do you overcome it? You got any knee pain, arm hurt, or anything?
Not yet. So far, so good. I'm 69 years old. I'll be 70 in November. And because of, in my opinion, because of doing Qigong and Tai Chi and Kung Fu, I still feel like I'm 30. So we'll see. But so far, yeah, I don't have any, I work on my flexibility all the time. I do, all the basic exercise things that we hated in gym class. I can do things above and beyond that when we do like a standard hook, again, connecting acupuncture meridian points from the finger and thumb tip. I can still make my fingers and thumb touch my forearm, so this type of extreme flexibility that I've worked on for a long time. I can do both hands. So, trying to keep the body in shape. Again, another one of accolades from Dr. Matt Mason, not only getting better, but learn how to stay better, right? Exercise, herbology. And then, I always said, check out the source. What do they do in China? It's not just acupuncture, right? And these other tool implements. They do everything. So whatever can help you. Yes, we know that, some synthetic drugs, of course, can be bad. Too much of them. They have to re-regulate them quite often. But if it helps the affliction along with maybe exercise and herbs and acupuncture possibly, try everything. And, as we know, as we've been told the last 30 or 40 years, how to eat correctly, right? Drink more water, eat more salads. Yeah, if you can, stay away from fried foods as much, So we know the process. It's just getting in there and doing it correctly.
Do we have any more questions? If not, I'd like to get John into the picture. John, can you stand next to Mark? And on behalf of Moy Family Association, thank you very much, Shifu. And I'll let you have the last word with John.
Thank you. Yes, this is my Tootie, indoor student. He's been with me for over 12 years now. He does competitions. The last competition he did, he had 4 events and he got first place in all 4 events. He'll be traveling down to Florida soon for another competition. But he's been my helpmate, my friend, my little kid. Sifu or Shifu means teacher father. So we have that relationship. I yell at him and he helps me, and he probably yells at me behind my back like any kid would do. It's okay. but he's a great guy. And I just, again, want to thank President Evelyn Moy Family Association, DC, for all your help and allowing us to go into your homes and do these Zoom events. Thank you. Told you.